Okay guys, so I'm going to talk about something really dear to my heart, and I'm currently in a PhD program for Oriental medicine. For 10 years I've taught at the local human Oriental medicine school here, and I'm moving into completing that program. So Chinese medicine to me is one of the most versatile medical modalities that I've studied. And one of the things, especially those of you who have taken the course through Veterinary Medical Aromatherapy Association, I talk a lot about in a TCM model. So we're going to talk a little bit about what that means today and present some case studies. Maybe?
Can I see that little, looking at the clicker?
Uh-huh.
That little right of the circle, there's a little button.
Forward.
Yeah.
Hey, it worked. Okay. Okay, so now I got something in my right hand, something in my left hand. This is dangerous. So this is just a little bit about me. As Judy said, I do have a lot of chicken soup behind my name. I love to learn. And one of the biggest motivators, okay, sweet spot. One of the biggest motivators for me to learn is the fact that it enables me to help an animal that I wouldn't have been able to help previous to learning that. And they always seem to come in exactly when I just learned something. So in my class, I had learned a new acupuncture technique. That afternoon, I had a little doxy come in, and it was exactly the right technique. Someone else had been working on the dog for 3 months, and 2 treatments with that new technique, the dog was working great. So again, that's why I learn, is to be able to have something in my hip pocket when I need it. Okay, so our disclaimers. Opinions expressed on this presentation are solely my own and do not express the views or opinions of HH4A or VMAA. They do not endorse, is not responsible, and makes no representations or warranties regarding such content or its accuracy. Encourage you to verify the explanations and opinions presented, and HH4A, VMAA shall not be liable for any harm resulting from or in connection with reliance on such content. So, you know, in this day and age, we have to have our disclaimers. And then this is just basically mine. This is information for educational purposes only, and when I suggest using essential oils, they are biologically active essential oils as appropriately labeled for use. And so this is not just any essential oil. And this goes out to this being recorded and getting on the internet, etc. Guys, I am very picky about my essential oils. They must be biologically active essential oils, or you can perform all of this at your own risk. And I take no responsibility if you do not use essential oils that are appropriate. Okay, so what is Chinese medicine, and how does it apply to essential oils? So when I first got started in essential oils many years ago, 1997 to be exact, that's his birth age. This is my son. So I was studying Chinese medicine at the time, and it just sort of naturally started to integrate, not just from my Western knowledge of from a pharmaceutical standpoint, but how did these work from an energetic standpoint in that traditional Chinese model. So the first part of this lecture is me explaining the difference in that model. You know, when I choose specific Chinese herbs, I don't choose them based on the pharmaceutical model. I choose them on the 5,000-year-old TCM model. the classic Chinese medicine model, which means that I need to understand that model in order to make those choices. I'm not choosing them based on my Western diagnosis, which I can do because I am a veterinarian. I'm choosing them based on my traditional Chinese medicine diagnosis. And that's the difference between somebody who's taken a weekend course in Chinese medicine and someone who's studied it since '97. Okay, so our first principle is called 8-principle diagnosis. And it all begins, everything begins and ends with yin and yang, okay? So, anybody have any background in Chinese medicine? Oh, this is awesome. So yin and yang. Yin and yang defines the world. And it started from Taoism and looking out into the world and saying, I think this is what's going on, and how am I going to relate to the world? And so they said there was heaven, yang, there was earth, yin, and I'm the bridge between. This is where yin-yang came from. And so then we started to, instead of having the fullness of this whole oneness with the planet, we looked at the dichotomy of the planet. So there was the bright side of the mountain and the dark side of the mountain. There was female and male. And yin and yang can be split and defined relative to whatever you're defining it to. So if I had gray and black and white, how would I differentiate yin and yang? Well, if I was applying yin-yang to the gray and the white, which one is more yin, which one is more yang? So in the case of yin-yang, the black represents yin, the white represents yang. So in that case, the gray would be yin, the white would be yang. But if I was comparing the gray to the black, relative, what we're comparing it to, just like Einstein's theory of relativity, okay, the gray then becomes what? Yang, compared to the black. So yin and yang is always relative in what you're comparing it to. And you can't have one without the other. So you could not compare and say black is black and it is yin without the comparison. And this is significant when you start looking at how this medicine came about. Next, we can differentiate into heat and cold. So, just by a show of hands, cold in relativeness, okay, in relation to heat, cold would be a yin or a yang property. So yin is contracted and dark, okay? So yin for the cold, and the heat, like I'm usually up on stage, right, is going to be more yang, right? So again, it's all relative. And in 8 principles, which is a very common way to diagnose in Chinese medicine, you're going, is it more yin or is it more yang? Is it more cold? Is it more hot? Okay, and then next we come up and we have a deficiency or an excess. So, a deficiency or an excess in relationship to each other, a deficiency, more yin, okay, and an excess is more yang, right? In relation for the heart meridian, it would also work for small intestine too. And this is the Chinese concept of these organs. And they're related to 5 elements. So who's ever seen this 5-element chart? So when we do the emotional lecture, we're going to talk a little bit about the 5 elements. Because these 5 elements have character. So we have these organ systems paired with the 5 elements. So the liver, gallbladder is very wood. The heart, small intestine is fire. The spleen, stomach is earth, lung, large intestine is metal, and then the kidney, urinary bladder is water. And then we had a little extra pairing, which was pericardium and sand jiao, and they come over here in the fire. And there's characteristics assigned from 5 element. And it was the natural progression. After we went to yin and yang, we started to characterize what we experienced in nature of ourselves, how we started to categorize what our world was. We call Western medicine a hammer. Sometimes it's just not appropriate. So if I'm going to put a screw in, I can use a hammer, but it's just not as good. You know, or if I'm going to hang glass, maybe don't want to use the hammer, right? So again, I just have more tools in the toolbox, and Chinese medicine happens to be one of those tools. Okay, so with Chinese medicine, the reason I got so excited about essential oils is that we were able to look at spirit disruptions, psycho-emotional based diseases or disruptions, stress